thank you very much for inviting me down here to talk to you folks about what we do. My colleague and I started Timely Medical Alternatives 21 years ago. Now, people say, well, what do you do? And I say, well, the best way to explain what we do is to think back to the 1800s. In your country, in the U.S., the abolitionists formed the Underground Railway to help black people escape oppression and brought them up to Canada, the Underground Railway. Our company we think of as an underground railway to take Canadians and free them from our dysfunctional healthcare system in Canada and bring them down to the U.S. So we're a reversed underground railway. Now, in many ways, I think I'm preaching to the converted when I talk to you people. You all believe in taking care of your own health. You're opposed to governments telling you what to do. You're opposed to insurance companies. So I'm preaching to the converted, but I'm going to tell you some things about Canada and their vaunted healthcare system that I think are going to shock you. Now, how did we get started? We got started in this business when I was talking to a doctor who had a family doctor who had a patient who was 85 years old. He was on a 12-week wait to see a urologist because he had kidney stones. Now, kidney stones are a debilitatingly painful condition. He was waiting 12 weeks. And I thought, this is horseshit. I'm not a politician. I'm not a doctor, but I know there's got to be a better way to take care of people's health than that. And we formed the company 21 years ago, and we haven't looked back. This last year, we facilitated $7.5 million worth of health care for our clients by sending them to the U.S. The problem with the Canadian healthcare system is that it's entirely controlled by the government. There's no private surgery allowed. If a surgeon were to do a private surgery, the government found out, he could go to jail. There's only one other country in the world who shares the Canadian healthcare system model, and that's North Korea. So Canada is in good company. There's no private surgery. There is rationed surgery. A orthopedic surgeon is rationed to 6 hours of operating room time a week. That's all he can work. And the government tells him that, and they pay him, so he has to do what they say. There are long waits for care, and healthcare insurance is not allowed. It's against the law in Canada. Now, I'm going to give you some examples here of how bad things are in Canada. I was talking to a man in a little town called Red Deer, Alberta, last week. He is on a 7-year wait for a hip replacement. He needs a hip replacement badly, but as soon as he can get in is 7 years. You're not going to believe this, but this is true. A man with the measles in Canada went to the emergency room. He had to wait from 2:30 in the afternoon till 1:30 a.m. the next day before he was seen. While he was sitting in the emergency waiting room, he infected 2 more people, and a total now of 3 people with measles. There was a story in the paper of a man who waited in an emergency room for 4 days. He finally gave up and went home, and he died the next day. It's a very bad system we have. I'll give you some more examples. A man in Vancouver, where I come from, was waiting for 2 years for a double lung transplant. very hard to get a donor for double lungs. They finally found one. He was scheduled for surgery. He was prepped for surgery, but they did not have a perfusionist. Perfusionist is the man who, I gather, operates the heart-lung machine while you're having this surgery. Couldn't find one. He was busy with somebody else. They had to cancel his surgery, and they had to throw those 2 donated lungs away because they only last for 4 hours outside of the body. So waited 2 years, and they canceled it. A man in Calgary had inoperable cancer. He was waiting 5 months for chemotherapy. In BC, which has 7.5 million people, because they have long waiting lists for chemotherapy, they have been sending people down to Bellingham, Washington, which is a little town in Washington State, 100,000 people. They're able to take care of the people from British Columbia, which has 7.5 million people, but the government can't compete with them. Keith Smith invited me to come down and talk to you folks today. He liked a couple of examples I gave at a previous talk he attended. We were contacted one day by the father of an 8-year-old girl who needed drains put in her ear. She had infections in both ears. She needed drains put in the ear. She was given a date at the Children's Hospital in Vancouver of 4 months into the future. And he said, well, 4 months, we can't wait that long. Take it or leave it, they said. I'll take it, he said. A week before the procedure to drain the infection, which, by the way, is a very simple procedure. A week beforehand, they got a call saying, we've had to bump your daughter. We'll be able to see her in September. And he said, well, she will have started the next year of school. She's already having trouble hearing. Can you not get her in faster? Take it or leave it, they said. He said, we'll take it. In September, a week before her planned procedure, they had to bump her again. They said, we can see her next Easter. At that point, he called us. We had her seen the next day down in Bellingham, the same small town south of Vancouver. We had her seen by an ENT, and he took one look in this little girl's ear. He said, I'm a good doctor, I'm a good ENT, but I'm not this good. She needs to see a pediatric otologist who can hopefully help you. Next day, we got her in Seattle to a specialist. He said, my job at this point is not to save her hearing, it's to save her life. The infection had crossed the barrier into her brain. She had a brain infection. When the dust settled, she had lost all hearing in one ear and half the hearing in the other, but she was still alive. And her father called me the next day and said, Mr. Baker, my wife and I think that your star shines the brightest in our heaven. You saved our daughter's life. That was quite gratifying for us. We had another client, Keith liked this story. A man in Ontario had a golf ball size tumor behind his forehead. They didn't know whether it was cancerous or otherwise. He was waiting 4 months for MRI, and we said, that's ridiculous. We sent him down to Buffalo. They did a biopsy to determine if it was cancerous. They really immediately realized it was a serious situation. They operated on him immediately. So his total time waiting was 4 weeks. His family doctor estimated had he waited in the system as he was told to do, it would have taken 8 months compared to 4 weeks. We were happy to have helped this man. We had another client who was a very prosperous farmer on the border of Alberta and Saskatchewan. He had 1 million acres in seed, in grains that he raised, very prosperous. He was experiencing all the classic conditions of heart disease: tightness in his chest, short of breath, pain on exertion. Couldn't even get an appointment with a cardiologist. He called us. We told him we could help him here in Oklahoma City at the Oklahoma Heart Hospital. He flew in his private jet that Friday. On Monday morning, he had a triple cardiac bypass. Certainly would have been dead had he waited in the public system. The judgment of the politicians is appalling. There's a man in Ontario, and there's two men I'll tell you about. One of them was 84 years old. He was waiting 5 years for a hip replacement. Another man told the government he insisted on surgery to provide him with both female and male genitalia for whatever reason. There is a clinic in Texas that does this kind of surgery. The government of Ontario paid for him to fly to Texas and have this bizarre surgery, and yet made this 84-year-old man wait 5 years for a hip. It's completely backwards. In Canada, 15,474 patients in 2023, 15,474 patients died while on surgical waiting lists. What's the problem here? Well, BC has a population of 6 million people. In Germany, they have 85 million people. So 85 million versus 6 million. There are more healthcare executives in British Columbia than in all of Germany, yet we have 6 million people, they have 85. The money is going to paper pushers, executives, directors of various parts of the hospital, as opposed to paying for surgeons and paying for care. Let's see here. One bureaucrat came up with the idea a couple of years ago of a concept called medically assisted in dying, medical assistance in dying, MAID, MAID it's called. At this point in Canada, one death in every 20, one person out of every 20 who die is with a physician-assisted procedure, euthanasia. It's easier to end people's lives than to provide them with the surgery they need. In Saskatchewan, one of the Canadian provinces, they have an information hotline, healthcare hotline. They have two options, amongst many options, but they have two others. One of them is you can contact them for giving you suicide prevention advice. If you opt for the other option on this healthcare helpline, they advise you how you can arrange to have yourself euthanized. It's madness. One doctor in Victoria, BC, has euthanized more patients than any other doctor in Canada. She takes some satisfaction in the number of people she's euthanized, as opposed to other doctors who take satisfaction in thinking how many people they've been able to help. Her greatest achievement is killing people. What have we learned from all of this? Well, several of the lessons that come from this is orthopedic surgeons ration to 6 hours of operating room time a week. They lose their skills. Their association said 6 hours a week is not sufficient time to maintain your skill level. What else have we learned? Family doctors who are paid by the government, many of them moved down to the US after graduating from university. where they can operate freely rather than under government control. Some family doctors who stay, some of them have thousands, literally thousands of patients on their list. They don't have time to properly deal with all of those people. The patient appointment times run for 5 minutes, and then you're out, and then the next one comes in. Let's see. U.S. surgeons have quite a different attitude than Canadian surgeons. Canadian surgeons, high percent of them have very poor bedside manner. And what is this? They don't need to have a pleasant bedside. They have an unlimited supply of patients. Surgeons in the U.S. are much more attentive to their patients and answer their questions because they want to have them tell their friends about what a great surgeon he was. Canada, they don't care what you think because they've got another 500, 600 people on their waiting list. When the Canada Health Act was proclaimed in 1984, and this is the act that governs the delivery of health care, and which has resulted in these long waiting lists. If you are a prisoner, however, you can get your health care almost immediately if you're in jail. But if you're out in the mainstream, you may have to wait 4 years. So some people have been told that the best way to get prompt surgery is to punch the healthcare minister in the nose. You'll be sent to jail for assault, and you'll get your surgery almost immediately. This is how crazy it is. It was promised in 1984 that people will no longer have to sell the family farm in order to pay for health care. Now, in jumping forward to 2025, people are still selling the family farm in order to generate the funds to cross the border and get the surgery down in the U.S. So nothing has changed except the surgery now takes place in the U.S. instead of in Canada. Now, I've set aside a little time to take any questions from people who may not believe some of these stories I've been telling you. I assure you they're all true. Has anybody got any questions for me? Well, there are limited spaces for doctors in medical school. They don't want to graduate tons of doctors because they can't afford to pay them once they graduate. And the effect of this is that a lot of people who do go to medical school get their tuition covered largely by the government, whereupon they pack their bags and they move to the U.S. and practice in Buffalo or Seattle or in a border city, having got low-cost education from the government.
So I went into practice in the mid-'80s in a little town in West Texas, Abilene.
Mm-hmm.
The best doctors in town were Canadians. Bar none. My first surgery ever was done by a man who had been a goalie for the Canadian Olympic hockey team.
Oh, really? Okay.
So I just wonder, after a generation or more of the socialized system, are the young doctors coming out now wedded to the idea of socialized medicine and like it's evil and immoral to be a independent doctor, as the Canadian system adopted that attitude? I know that British doctors talk like that. It's, Stockholm syndrome, I guess.
Well, the answer to that, I would say, is that in your country, it's pretty well 50-50. Half of your population are Democrats, half are Republicans, totally different views. Same in Canada. There's many doctors who think that they work in the best healthcare system in the world, best healthcare in the world. The others pack their bags and move to the U.S. So there is a division of thought. I know if I were a doctor, I would be be wanting to be practiced down here. Some of the people we send a lot of people to Phoenix, Arizona for orthopedic surgery. And the surgeon we use is constantly reviewing the diagnostic package we send down for a patient. He'll review it and he'll say to the woman, "What does your doctor tell you about the fact you appear to have a raging bladder infection?" And the woman will say, "Well, my doctor's seen all the numbers from my blood test. He didn't say anything about the bladder infection." They don't have time to properly look at the results because they have people waiting in line to see them 5 minutes later. So here's the orthopedic surgeon who's diagnosing medical issues, which is crazy. Shouldn't have to. Any other questions? Yeah.
So props to you for doing the work you're doing. I'm in the US. I'm an employee benefits consultant. I have a hard time identifying high quality, affordable providers. How do you and your company go about researching and finding who are the right high quality, low cost providers for your clients?
Okay, good question. Many years ago, when I first started the company, I drove across the northern states of the U.S. thinking that I would like to find providers close to the U.S. so people could access them easily. What I subsequently found was that the hospitals in bordering Canada charge much too much because people don't think that they have the option to shop around. They immediately say, "Well, I'll just go to the U.S." and they go to the nearest city. I subsequently found that was not a good strategy. Then I ran into a doctor in South Dakota who worked at a hospital that was owned by the employees, self-employed hospital, doctor-owned hospital. I realized that those were the very best hospital because sitting in Vancouver, I have no way of vetting the quality of the surgeons. But if I'm dealing with a hospital that's owned by the surgeons, if they need another orthopedic surgeon, they're not going to invite some slug to come and join them. They will know who the very best surgeon in town is. They'll invite him to join their group. So then we decided we were going to focus on sending people to physician-owned hospitals, and that's worked out well. But beyond that, over time, you get to realize which doctors are better, and they're the ones who will take time and respond quickly. If I call Keith Smith, say I've got somebody who needs surgery, how much? Keith will say, "Give me a second, $2,300 or $3,200. Now, that makes my job very, very easy because if we have another example, one time we got a call from the Eisenhower Medical Center in Palm Springs, California, saying, "We want to get in on the action, Mr. Baker. We see you're sending hundreds of people to the U.S. We want to get in on the action." I said, "Okay, what would you charge for hip replacement?" "Well, I don't know." I said, "Well, find out, get back to me. I'll let you know if it makes sense to add you to our list of providers." So a week later, I got a call. "Yeah, we can do it for X dollars," which was significantly higher than we pay in Phoenix, which is a 4-hour drive from Palm Springs. I said, "Well, I could add you to our list of providers, but who's going to pay that kind of money when we can get it for $5,000 or $6,000 or $7,000 or $8,000 less in Phoenix than you're charging here?" So the ability to get back to us quickly with quotes, the references. We have the surgeon we use in Phoenix now, orthopedic surgeon, has successfully operated on 1,500 of our referrals in the last 10 years. Every one a complete success. We have hundreds of testimonials, so we have no difficulty whatsoever in referring people to him because he's always done a job for us. Does that answer the question?
Hi.
Hi.
We are in the primary care space,
Yep.
so we're very big about the preventative side.
Yep.
Do you guys work? Is there any opportunities to work in that arena with the Canadians? Because we've actually had several reach out to us, but we didn't want to negotiate or navigate the laws, so we just kind of stayed away.
So give me a little bit more detail. What sort of services do you provide?
We actually do like functional medicine, root cause deep dive, but also primary care. So a lot of the specialty testing, gut testing, some of that kind of stuff, they're reaching out wanting to do those things.
We don't do, all we do is surgery. We don't do any medical referrals. They're only surgical. The reason being that it's very easy to determine how much to charge for a hip replacement or a knee replacement. It's the same for everybody. But if they go in for cancer treatment, chemo or anything of that nature, there's no way to estimate ahead of time exactly what it's going to cost. So we only deal with surgery. I'm sorry. Any other questions? Yep.
I have a question about that provider that you're using in Phoenix. I'm in Phoenix looking
Yep.
for more direct care options.
Yep.
Patients in Phoenix. So I'd love to know the name of that doctor in that clinic.
His name is Dr. Kassman, Kassman. He operates we have a surgery center where he does the majority of his surgeries, and we also have a full-service hospital. If people have other issues compounding the problem, if they have diabetic, if they have previous heart surgery, whatever, they go to a hospital. If they go to the surgery center, it's because they have no other complicating condition. There's only a $1,000 increase to go to the hospital compared to the surgery center, which I find is remarkable. The surgery center is the Ortho Arizona Scottsdale Surgery Center. Tell them I sent you. Okay, I thank you very much for your kind attention.